Kumar and you're watching India Science. Well, India's cumulative COVID-19 vaccination coverage exceeds 187 crores. India reported 2,541 new COVID cases. More than 3.6 lakh vaccine doses have been administered in the last 24 hours, and the recovery rate currently stands at 98.75%. As COVID-19 continues to surge across the globe, COVID-related queries and health-related queries are on the go. People are speculating about health problems, and we get you the queries on cardiology today. In this program, where we take your questions from Facebook and YouTube Live, we are joined by the very well-known Professor Rakesh Yadav, Professor of Cardiology at the All India Institute of Medical Sciences, New Delhi. Many thanks for joining us today, sir, and welcome to India Science.
Thank you. Thank you.
Thank you, sir. What is the advice and protocol for cardiac patients during the new XE variant in the COVID-19 pandemic? As we've recently seen over the last 1 week, there has been some speculation. So what are the protocols that you're following in the hospital, sir, and what is your advice for them?
Yeah, I think it's a standard protocol which everybody need to be following. And I think there's no new amendment or no new advice in a protocol. You have to wear a mask now. And I will always suggest that preferably you should wear N95 mask. Second, you have to maintain a distance, a regular hand washing. And if you encountered any person who is having fever or cough, I think you suspect him strongly a COVID patient, and you should maintain a proper distance from that patient with all the mask. Mask is very important. I think that is the only thing which is shown to be more effective. So I think this is a time that we should start again practicing our standard COVID protocol.
Right, doctor. Can you tell us something about low blood pressure post COVID-19? There are many people who are complaining of this kind of symptoms, sir.
Absolutely, it is very correct. And if you have a COVID, we have seen our patients that after COVID, they are on 2 or 3 antihypertensive drugs. And practically all the antihypertensive drugs need to be stopped because their blood pressure is coming very down. Don't think it's a good sign. Don't think it's a good sign. People start becoming happy that, oh, my blood pressure medicine is going to be reduced. But no, it is not a good sign. It is basically an autonomous dysfunction which we are seeing in a COVID patient. Sometimes what is happening, the blood pressure is increasing post-COVID. Sometimes the blood pressure is falling post-COVID. And many times we encounter a disproportionate increase in your heart rate. So your heart rate was 60, 70 before COVID, and after COVID, it remains 100, 110. So it's a what we say, unexplained tachycardia. That is also very well seen in post-COVID patients. So if you are encountering these things, you should not be very, very happy. I think you should take consultation of a cardiologist or any doctor. In majority of the time, this doesn't require any treatment. You have to just wait and watch, avoid complications. And if you have a low blood pressure after COVID, increase your fluid intake, salt intake. And if you are on any antihypertensive medication, I think continue to monitor your blood pressure and decrease your blood pressure medications. But what we have seen that usually after 6 to 9 months, the blood pressure again start coming up. So you require to add antihypertensive in those patients. So be cautious, regularly monitor, take advice. Don't be very happy if your blood pressure is coming low post-COVID.
Right, doctor. What you're saying is low blood pressure is an equal matter of concern. Absolutely.
Yes.
You just spoke about diet precautions. Interestingly, we have got a lot of questions from our viewers on diet. What are the type of diet precautions do you think a heart patient must take, sir?
There's two important things. If you are a cardiac patient, there's a lot of disease of cardiology. Simply, you have a coronary artery disease and your heart function is normal. At that time, I think you do not require any extra dietary precaution during COVID. You should maintain whatever the advice you are being given. That don't take excessive salt, don't take excessive saturated fat or trans fatty acids. Maintain your weight, eat in a regular bouts, not in a heavy meal. But if you have a heart failure, if you have a valve problem, your heart function is low, and if you feel breathlessness on walking, and if your heart function is decreased, I think at that time don't drink lot of water, because what is happening that COVID people are advised to drink lot of water, lot of fluid. So if you have a heart failure, previously heart failure, if your heart function is decreased, if you have a kidney patient, then please do not take excessive water. It can be accumulated in your body and you can go in heart failure. So that is a very, very important. So not in every patient you should encourage to increase your water and salt intake. So if you are a heart patient, I think it is always better to take advice of your doctor before venturing in these type of WhatsApp messages, WhatsApp advice, which people fall and often they deteriorate themselves. That is
Uh,
very important.
Absolutely, doctor. We have a YouTube question from Ananya, and she writes in to us from Delhi. And she says that her mother has to undergo a heart surgery, but so she took her first jab and she wants to know after the second jab, is a booster advisable after the surgery or before that?
The important thing as at present, the policy is that every high risk patient should receive a booster. But if you have a recent COVID, I think booster should be delayed for 3 months. So it's always advisable that if you are falling in a window period of the booster, so you should always take a booster, especially if it's a high risk patient. And definitely, if your mother-in-law is going to have an bypass surgery, she belongs to high risk category. So these patients are benefited by taking booster. There's no doubt about it. So if your time allows you, you are 6 months after second dose, I think you should take a booster.
Right. But if you've had COVID, then the ideal period to
three
wait
months.
is 3 months. That's what you said.
Ideally, you should avoid up to 3 months and take it after 3 months.
So we have another YouTube question from Shivam, and he says one of his aunts is diagnosed with arrhythmias. Can you please explain what?
Arrhythmia.
Yes, this diseases and what precautions
Ba-
must be taken in this pandemic, sir?
bas- Basically, arrhythmia is your heart rate beats at a rate of from 60 to 90. So if there's any deviation in the rate or rhythm of your heart beating, it beats fast, it beats slow, it beats irregular, it is not an arrhythmia. Rhythm is not proper, though that's why there's a rhythm. Abnormal rhythm is known as arrhythmia. So abnormal rhythm of the heart, abnormal rate of the heart is arrhythmia. So arrhythmia, there's I think 100 varieties of cardiac arrhythmias. Some arrhythmias are benign arrhythmias, not to worry. Some are very serious arrhythmia. So if they are diagnosed, if your any relative is diagnosed as arrhythmia, I think it is always advisable to take a help of cardiologist to diagnose which type of arrhythmia it is. And as I have previously told that in COVID, post-COVID, after COVID, your chance of arrhythmia increases. And majority of the time it is a sinus tachycardia. Means your heart rate is more than 100 per beat. So your heart rate increases. This is known as sinus tachycardia. And it is very common post-COVID. So if it is there, I think it is always wise because I cannot on phone tell you what illness you are suffering from. Are you diabetic, hypertensive, on which medication you are on? So if you consult a doctor, it is always advisable. But if you are having certain arrhythmia post-COVID, I think you should not take it lightly. Go and discuss with your cardiologist which type of arrhythmia. And thus, drugs are available, it can be treated. So if it's properly diagnosed, it will be helpful for you.
Right, doctor. Another question that I'd like to ask you here is how do you specify the difference between heart attack in men and women? What are the things that are particular to women? Are they more prone?
Absolutely, it's a very good question. Always remember, after menopause, the heart attack incidence among women and men are equal. It is only second important thing in Indian setup, what we have find the women heart attack is usually more fatal because it is often ignored. Usually, it is seen that women often ignore their symptoms. Usually, in our setup, the treatment is also less with women. They go to a hospital after more delay time as compared to male. They are not very much in regular habit of taking medicine. Usually you see their diabetes is in majority of the women, diabetes is uncontrolled, hypertension is uncontrolled. So what we are seeing that if you compare with men and women post-menopausal, the complications are high in women. But the incidence of heart attack is practically equal after menopause. What we are seeing nowadays that the heart attack is increasing, which is known as coronary artery disease, blockage into the artery, making it heart attack. it is usually seen in young women also, and that is because of the lifestyle. The smoking rate in women has increased, the alcohol is increased, usually the obesity has increased, there's more diabetic in women now in younger ages, more hypertensive. So all the factors which contributes to the heart attack are now coming in younger women. So the younger women heart attack is also increasing. So now I always say that being an Indian, we have a high risk of heart attack, and we are at present world capital of coronary artery disease and diabetes. So it is, as I always say, it is a volcano which has busted. I don't say it will bust. It has busted, and the government is also taking a lot of programs to make public aware that please control your diabetes, please control your hypertension, don't be obese, please do some yoga or exercise, please take a balanced diet, don't smoke. If you are taking alcohol, minimize this to minimum. So this all factor will definitely contribute for prevention of your heart attack in women.
Absolutely, sir. Studies suggest that cytokine storms are a serious complication. Can you please explain that?
Absolutely, it is very correct that if in a COVID you go in a cytokine storm, it is a very serious disease. There's no doubt about it. What happened that your body with a COVID infection, everybody fights. So if you fight with a COVID, then the COVID intensity is decreased. So body fights. Or your body has lot of small things which fights with the virus. So if the fighting is very intense and you in your blood lot of cytokines are released, it is harmful for your body. So once you have a cytokine storm post COVID, I think it's a serious thing. We always take it's a serious, and mortality is very high. So these patients require a very intensive care under a good hospital and a setup. So for a layman, if somebody are diagnosed as a cytokine storm, I think you should take all things that this patient should be treated in a good multidisciplinary hospital, because chances of chances of ventilation is very high, chances of kidney damage is very high, chances of heart damage is very high. So cytokine storm can practically damage every organ of your body. So it's a serious complication of it.
Yes, so on that note, I'd like you to please explain the term with an example, stress cardiomyopathy. Why does this happen?
It is known as Takotsubo cardiomyopathy. Takotsubo cardiomyopathy was first diagnosed by a Japanese scientist. What happened when you have a stress? Your catecholamine levels increase in your body. So what happened? The apex of the heart got dysfunction. So it mimics like acute heart attack. So the stress-induced cardiomyopathy, the ECG changes are like acute heart attack. But when you do angiogram, usually the coronary arteries is not blocked. It is open. There's no clot. It is not blocked. So your heart function decreases suddenly. The ECG changes are like acute MI. You have a severe chest pain. If you do all your enzymes to diagnose heart attack, they are raised. And it is usually seen in stress. That patient is in CCU, everything is normal. Suddenly he starts having chest pain and breathlessness. Echo is done. Echo finds that heart function is very less. One part of the heart is going to die. And if you do angiogram is normal. So this is an entity which is seen, which is a very common entity, and we always, every cardiologist practically know this entity. And the treatment is nothing, wait and watch. You have to decrease the stress. You have to give a supportive treatment. You don't require angioplasty in these cases. And majority of the cases, what we have seen, heart function improves. So this is an stress cardiomyopathy.
Right, doctor. Another question that we are being asked again and again is what is myocarditis and what is pericarditis? If you could explain, and are they connected with viral infections?
The basic, you understand, the heart muscle. The heart has a muscle. The muscle is the most important thing. So anything which happened to the muscle is known as myocarditis means infection of the heart muscle. Then the muscle has an endocardium. Endocardium is when the inner part of the layer is known as endocardium. Then there's a myocardium, and then outer part of the heart thing is pericardium. Pericardium is a fibrous tissue. So the muscle above is circled by pericardium and below is by endocardium. So if any infection occurs in muscle, it is known as myocarditis. If any infection occur in outer layer of the heart, which is pericardium, it is pericarditis. Usually, it's not that it's only myocarditis. Myocarditis is associated with some amount of pericarditis. It's a mixed thing. So in COVID, usually we see that it is a myocarditis which is there, and it's a direct infection of the heart by the virus, or the heart is because of some autoimmune disorder. So what happened that the myocardial start damage, the heart function gradually decreases. So it is a myocarditis. And when there is a pericarditis, what happened? There is an accumulation of the fluid into the pericardial cavity, which is outside the heart muscle and below the pericardium. So it can lead to pericardial fusion. So that is pericarditis. So these are the three terminology which is often used.
Right, doctor. Another question that comes to my mind is that although COVID-19 is a primary respiratory disease, 20% of children, if we are seeing these days, are being affected with some cardiac-like small symptoms as well. Please tell us how you look at this whole perspective. Why are children suffering?
The important thing, it is presumed that it was only the respiratory disease, but no. What we have seen that this COVID is involving every organ of the body, because it is basically related to the ACE receptor. The COVID virus is attached to the ACE receptor, and receptor are abundant in lung, receptor are abundant in kidney, heart, brain. So now what we are seeing, it is only the Delta variant in which the lower lung is involved. But in other variant, we have seen practically, believe it, about 50% of the patient who has COVID develop some form of neurological problem. They have an insomnia, they have got attention deficit, loss of memory. So some has increased depression, anxiety, the cardiac involvement. There is a study which has been done that all the patients who were admitted for COVID, if 3 months after that, an MRI of the heart is done. So in up to 50% patient, the heart involvement is shown on MRI. So now we believe that the COVID involves the heart. However, what is happening that in all patients, it is a mild form, it goes away. But yes, you are absolutely correct. In a severe COVID, around 40 to 50% has cardiac involvement. Even in a mild disease, what we have seen. So if as you have earlier asked, your blood pressure become low, your pulse rate increases, all is related to cardiovascular manifestation. So absolutely correct. The cardiac involvement is not what I say, it's a serious thing. It is a concerned thing. And what we are seeing that yes, though it is a mild COVID, majority in some patient, they come with the decrease in heart function. Some comes with an acute heart attack. It has been also shown that post-COVID chances of heart attack is increased. Post-COVID chances of sudden cardiac death has increased. Post-COVID, your blood pressure autonomous dysfunction has increased. So yes, it has been seen and it has been reported. So I don't think that people should not believe it is only a respiratory disease. It's very well cardiovascular involvement is there, kidney involvement is there, neurological involvement is there. And now what we have seen that after COVID, there is a surge of diabetes. So diabetes has also increased after COVID.
Absolutely, sir. And as you rightly said, children need to be more cautious and careful and avoid going out until it is very, very important. Please explain to us now what you mean by broken heart syndrome, sir.
I think broken heart syndrome is just like a stress cardiomyopathy. This is the same thing. Some is labeled as a stress cardiomyopathy, some labeled as a broken heart syndrome. So it is all the synonym of one disease. So it's same thing. Broken heart syndrome or stress cardiomyopathy is the same thing.
Also, sir, what is intra-aortic balloon pump? This is again come on our YouTube. ECMO or ventricular assist devices in this setting,
Yes.
and when are they used, sir?
What happens when your heart function goes down and heart doesn't pump the blood as it should pump it? So these are the devices. These are the heart assist devices. This is ventricle assist devices. Intra-aortic balloon counterpulsion, which is known as IUD, is a balloon which is put into the aorta. So it helps in unloading the heart. So there are a lot of other assist devices which has come, like propeller device. Lot of ventricle other assist devices are in the market. So it's basically, for a layman, you should understand, when your heart is not able to pump the blood because the heart function is too poor, these are the devices to assist the heart to pump the blood to the body so that your blood pressure can be maintained.
Yes, sir. Sir, now again we have a YouTube question. This comes from Satya Prakash from Lucknow. He says that reports suggest that primary respiratory failure is a predominant finding with associated fever, cough and other flu-like symptoms. But is this true, or do you have a different perspective on this?
COVID and coronavirus is a respiratory virus. It is a flu. There's nothing. You have always a flu. So it is a virus. You have influenza virus. So this virus damages more as compared to influenza virus. It is more contagious. So if you say that COVID is a flu disease, I can accept it. It is a flu disease. It is basically involving your upper respiratory tract infection, but Delta variant is involving the lower respiratory tract infection. Omicron, you have a mild cough, mild with sore throat, and it goes away. So you can label the COVID can be labeled as a flu, but because it is has a very wider implication, very contagious, involving practically whole of the world. So it has been labeled as a different disease like COVID-19 disease. It's a flu. It's basically a flu.
Right, doctor, if you could comment now on the accuracy levels of local oximeters. People do want to know.
The important thing is, with an oximeter, it is your saturation which is detected. So for saturation, it is good. But don't rely more on your pulse rate with oximeter. Sometimes the oximeter gives fallacious pulse rate. So if you have brought a standard oximeter, the accuracy is very good, no doubt about it. But you have to take certain precautions, that you have not put a nail polish over your nails. You should not have a very oily skin. You should always wash your hand before taking it. So these are the precautions, and it should be tightly engulfing your finger. But a good oximeter will give an accurate saturation, that is true. But don't rely a lot on pulse rate. With some majority of the time is give an accurate pulse rate, but don't rely 100%.
Absolutely, sir. The audio is breaking in the middle. Anyways, my next question is, if a person is getting a heart attack, how could we possibly give them first aid? If you could give us a few steps on that as well, sir.
If you are very sure that patient is having heart attack, I think the only thing which you can give is a Disprin. Dissolve Disprin immediately. So do one thing. If everybody can feel a pulse, you can feel a pulse. So feel your upper limb pulse and lower limb pulse. If both pulses are felt simultaneously, give Disprin. Dissolve 325 milligram Disprin in water and give. Don't give any other medicine. It's always a myth, because you cannot measure the blood pressure. Majority of the time, people used to give 2 tablets of sorbitrate to these patients, and suddenly the blood pressure drops. And the second important thing, make that patient rest straight on a bed. Don't make him to walk, and take him to the hospital. The 3 things need to be done immediately. Don't try to give don't try to give some acidity medication in these patients. Don't try to make this patient walk. Tell him, just relax, give Disprin, take this patient to the hospital. That is the only advice which we are giving to everybody. Don't give sorbitrate in these patients until you measure a blood pressure.
Right, doctor. Sir, another question that people would like to you to answer is that, do vaccine side effects differ for people with pre-existing cardiovascular diseases or even any other diseases? Sir, as a doctor, you might like to throw light on this.
Absolutely sure, the vaccine has a side effect, but the benefit of vaccine is much more than having a side effect. So all the side effect of this vaccine is needed. If you have a more comorbidity, yes. the chances of side effects are higher. If you have a normal person, the chances of side effect is lesser. So it's very true, but the side effect, you cannot predict who will have a side effect. There are majority of the time the side effects are a mild side effect in the form of fever, body ache, that's all. But yes, it is also reported that vaccination can lead to acute heart attack. Vaccination, even there's a reports post vaccination sudden cardiac death, but they are in a range of over, I can say 1 lakh is to 1, 10,000 is to 1. So, so the side effect of vaccine is there. You should always be vigilant when you have taken a vaccine. That if you have having anything, go to your doctor. But the benefit is much more. So we always say everybody should be vaccinated.
Absolutely, sir. If you can tell us a little about the heart muscles and why they weaken and how people could sort of take precautions to strengthen the heart muscles, sir.
There is no way. No way you can take precaution. Yes, what is the precaution? Sometimes your heart muscle get damaged because of your blood pressure. So control your blood pressure. Your heart muscle get damaged because you have uncontrolled diabetes. Control the diabetes. Your heart muscle damaged because of acute heart attack and there is a direct relation with smoking. Stop smoking. If your cholesterol is very high, take drugs to control the. So all the precaution which is required for prevention of heart failure or acute heart attack, you have to take it. And if you have a problem of heart muscle, take regular medications, consult your doctor. But if you say that with a COVID, how can I protect my heart muscle? I think it is all the luck that your heart muscle weakens after COVID. My heart muscle doesn't get weakened after COVID. It is all idiosyncratic. It is all luck. Nobody can predict it. That COVID or COVID vaccine in some patient cause cardiac damage, in some patient don't cause cardiac damage. But it is very sure that if you have a severe COVID, if you require hospitalization, the chances of your heart muscle damage increases. So I think the only thing you should, once you have a COVID, you should immediately take attention of a doctor. That can only prevent it.
So the problem of blood thinning is also being noticed by many patients. What
Absolutely.
is advisable as far as blood thinners go? How many to take? What not to take?
Absolutely. If you have a moderate to severe COVID, you're required to have a blood thinner. If you have a severe COVID, people used to give blood thinner for a month, and then it can be switched over to antiplatelet. Some people with moderate COVID, with a high risk, people start antiplatelets. Mild COVID is not recommended, but if you are on a blood thinner, continue on blood thinner. So yes, blood thinner has a role in COVID, and there is a clear-cut guideline. But if your doctor advises, I think you should not say no, because there is a guideline which is calculated by the ministry also, and it is guideline which is in the net, which patient should receive which amount of blood thinner. So it has a role.
Absolutely, and the follow-up with the cardiologist is more than important rather than self-medication, as you rightly said.
Yes.
And on that note,
I don't say you should follow to cardiologist. To a good physician. I think these all the things which is available in the net. They are being taught. So I never say that if you have no active cardiac problem, follow up with your physician. I think they are all taking precaution for a blood thinner. They know. But yes, if you have a cardiac problem, preferably you should always consult a cardiologist.
Absolutely, sir. And in the end, I'd like to thank you, Professor Rakesh Yadav ji, for joining us and sparing your valuable time today and educating us. And with this, friends, this is a wrap of this edition of Let's Talk Health. We'll be back with more interesting episodes on Let's Talk Health. Till then, take the booster shot and stay vaccinated, stay safe and keep the mask up. On that note, namaskar. Many thanks for watching. Keep watching India Science. Thank you.